Okay. Good afternoon. My name is Bernard Grimm. I'm an attorney here in Washington, D.C. I've been practicing for over 26 years. I don't think I've ever had a case with the circumstances that this one has. I represent a man named Dr. Alan Salerian, who's seated here today, and in a few moments we'll have a chance to talk to you. But on April 6, 2012, the city served notice of a summary suspension on Dr. Salerian that he could no longer write any Schedule II drugs. And for those of you out there, know that Schedule II drugs are very important drugs for people who are physical and emotional pain, people that are really at the edge of their life and cannot really cope any longer. And I'll let Dr. Salerian discuss the psychiatric aspects of that. We immediately sent a letter the next day to the senior attorney for the District of Columbia and asked that person, quote, and told that person, quote, suspending Dr. Salerian's registration without notice will subject his patients to the dangerous and painful abrupt cessation of life-saving medications. We went on to say in that same letter that was delivered the same day we received the notice, in the alternative, Dr. Salerian requests that the suspension be lifted for at least 7 days so that Dr. Salerian may advise his patients that he will no longer be able to provide them with their medication and refer them to other physicians or assist them in the withdrawal process. We not only asked for his license to be returned for Schedule II, we asked the city just meet us halfway because there will be catastrophic consequences for people who are essentially ripped off from a life-saving device. We heard nothing from the city. On April 10th, we were forced to file a lawsuit against the mayor and the city complaining that as a result of this summary suspension, people will be seriously injured, hurt, perhaps even die. We went to say in that lawsuit, the symptoms of withdrawal are serious, painful, prolonged, and can be life-threatening. The city's response to this was Dr. Salerian is scheduled for an administrative hearing. We had that hearing. We haven't had a result or a decision on it yet. But their answer was Dr. Salerian can have an administrative hearing. And at the end of the hearing, he either loses or wins. If he wins, he gets his Schedule II rights back. At that point, it was already too late for individuals and patients who rely on Schedule II narcotic drugs and therapy and help and support groups and visits and therapy from Dr. Salerian and his social network inside his office, and that was all cut off them. Just imagine being in the water and have somebody lifting a life jacket from you, because that's really it. With that being said, I'm going to introduce Dr. Salerian, who will now explain to you the consequences of what happened for his license, one, not being returned to him, and two, not even being temporarily returned to him. Thank you.
Thank you, Bernie. In fact, in public, I want to say thank you for all the wonderful help, and thank you to my staff who stood by me so far. But this statement is really a humanitarian statement about my concerns, about my fellow men and my patients. I see myself as a captain of a ship with thousands of passengers. I feel it's my duty. I feel it's my job. It's my privilege. I enjoyed this ride for 40 years as a doctor. I'm not going to complain about the first major storm. For 40 years, people trusted me as a doctor. I have been on top. I've been the chief psychiatrist for the FBI. I have been the medical director of a private hospital. I have had all kinds of good things happen to me because of medicine. And today, again, I feel that it's my obligation to warn my fellow men and colleagues, the system, and most specifically, it may sound grandiose, but I'm very sincere on this, President Obama and presidential candidate Romney, and asked them, what would you do for future generations and for future Americans not to face this very unfortunate dilemma, which is what my patients are going through. After April 5th or 6th, some catastrophic events happened. Bottom line is very simple. 2 people died, I believe, as a direct cause of the stoppage of my practice. 2 human beings felt hopeless enough and desperate enough to commit suicide. And a third person almost died. It's a miracle. Spent 7 days in a coma and had 2 cardiac arrests. It's a miracle. I don't know anybody in my 40 years of experience that could have survived what this woman survived. Thank God she's doing well and alive. Gave me permission, in fact, to mention her first name, Laura. But why is this happening? It's nobody's fault. There is a split, I say, between science and certain guidelines we have. And when there is this split, there is this gap, when a doctor is trying to find a way, a path to negotiate, to be Hippocratic and scientific, and we're not certainly abiding by the guidelines in some ways, that gap is creating this kind of bureaucratic mess. I'm not blaming anybody. I am saying again and again, please let us be aware, authorities. Let's wake up. When we go to a doctor, we want a doctor to be a doctor. We want a doctor to be a doctor, a physician. Respect Hippocrates. Hippocrates means one thing: the patient comes first, then you. If I'm worried about my license, that I'm going to lose my license to DEA or FDA, I'm in trouble. I'm not putting my concerns about my patient as number one. I'm making it number two, and that's anti-Hippocratic. That's where I feel my dilemma is. I'm facing the reality that for whatever reason, powers or systems or ignorance may dictate my course. But now, based upon what I see a catastrophic and not exaggerated picture. I have 2,000, nearly 2,000 patients. I've been warned enough. I've heard these words and threats enough. There will be more suicides. And that's my worry. I want to make sure that the system is prepared. I'm horrified that the system was not prepared. That is, the system is shutting down. It's like telling a captain of a ship, stop moving now, just don't sail. Wait in the middle of the ocean. It's not an option. If you do like this, sooner or later, something is going to come. Every life matters. Where is Joe, this 22-year-old boy who's dead now, who pleaded with me about finding a doctor, and I could not find. I sent him to a methadone clinic. And then poor Joe, he cannot afford it. He's discharged. He's gone. But there are no numbers. People are not statistics. To me, should not be to any physician. Period. We lost Joe. We almost lost Laura. We lost John, whose name was in my waiting list. Could not wait. He blew his brains out. These are real numbers. I won't go into the details. And basically, I don't want to repeat the same thing. I'm concerned about the gap between neuroscientific knowledge and our guidelines of practice of medicine. I'm very concerned that bureaucracy, without a soul, without any medical input, who made a decision to take my DEA privileges away? Was there a physician involved? It's horrifying. I bet my medical diploma there was not a single physician involved in the decision-making. How is it possible? How can a nurse or a pharmacist or a lawyer make a decision about a doctor's practice? Not a doctor. I'm a physician. I'm not arrogant about nurses or pharmacists, but damn it, I'm a doctor, sorry. I'm a doctor. Let a doctor take my license away. If I let you down in my practice, it didn't happen. A lawyer, a nurse, and a pharmacist, in some kind of coup, took my license away. That explains it. It shouldn't happen. It did happen. How can we fix it? How can we go from here? I have answers. Let doctors decide about doctors. In fact, that's us. That's our system. And if people go around this and say, and like creative ways, as the system and the mayor found, they did not use my medical practice. They said, you're a drug addict or a drug dealer promoting addiction. They chose another way, and then please do it expeditiously. It's not about me. If another doctor finds himself in this position, I plead with you, for next generations, let us do something right. Let us not expose other doctors to the agony that my family, my associates, and my patients have been put through. That's where I stop, and Bernie and myself will be very happy to take questions from anybody listening to us.
Doc, I actually have a question. I know the answer to, but I think. Oh, sorry. Sorry about that. Excuse me. Yes, I'm sorry. Doc, I have a question that I think people in the audience might have. I know the answer to, I believe, but why wouldn't, when your license was suspended, why couldn't you send your patients to other doctors? I'm sure there's other psychiatrists in the District of Columbia.
In fact, I did, but there is a fear factor. Thank you. It's a great question. There's a fear factor. My name, for whatever reason now, is dirt. No doctor wants to be associated with me. It's humiliating. I'm embarrassed. I have a thick skin, but even I'm embarrassed that when a doctor sees my name, oh, it's Salerian. No. 18 doctors promised to take patients from me. Only one accepted patients. 17 found ways. What is the alternative? If you don't come to Salerian, and suppose you're a pain patient or you suffer from an addiction, what is the other option? The other option is to go to a methadone clinic, and that means going to a clinic every day, 30 days, loss of travel privileges, and paying $900 a month, 3 times more than what you would pay to a private psychiatrist or a doctor. Do we have anybody calling or questioning?
We have calls, but no questions as of yet.
What happens with the calls?
They're here, but they don't have questions as of yet. Okay, hold on a second. One is coming in.
Go ahead.
Our first question comes from the line of a patient, Tammy Leach. Please proceed. Ms. Leach, your line is open. Please proceed with your question.
Can you hear me? Hello?
Yes, I can hear you, Tammy. Go ahead.
The biggest question that I have right now, I have several. What do the officials, such as the D.C. Board of Health, the DEA, the people that ultimately caused this problem with you, Dr. Salerian, do they have any other solution besides the methadone clinics, besides people being forced and pushed into suicide and the agony that your patients are going through right now? Do they not care or have – why did they not have something ready and available for these patients?
I think that's
Because you had a 22-year-old that committed suicide. Do they not care about any of these people that is being tortured the way that we are?
That's a great question, and I'm going to take it in 2 parts. Systems do not have souls. I think that there is no system that care. So that's how modern organizations and groups are. That's not necessarily the problem. I think the problem, and I don't believe if you're working for DEA or FDA or any agency, you're a bad human being. I think that it will be so unfair for us to think that it's the badge and the human that's doing. It's not. The bigger problem that we must face is the following: ignorance, lack of knowledge, and lack of effective communication. The system is not well informed of the advances in neuroscience. The laws of DEA, the laws of FDA have been written 40 years ago. For God's sake, look how much we have advanced. Medicine is improving and advancing so fast. What's happening in medicine cannot happen in engineering. Cannot. It's only in medicine that we're holding on to the scientific knowledge that established the principles. Even the classification is so ignorant, it's laughable. It makes no differentiation between things. As if you go to Safeway, it's only food. So if it's food, it's potato, pasta, tomato, Coca-Cola, everything is mixed. It's one. There's no difference. No, drugs are different. Every drug is different. There's no such thing as narcotic. Our classification is based upon such simple potato-like classifications. It's even difficult to make a logical argument. But you see, I cannot blame DEA or FDA. We have a bigger societal problem of this split between science and where our guidelines are. And Tammy, you are a victim. I'm not a victim, but I'm a witness to this victimization. That's heartbreaking.
I feel they're attacking. Why do they blame the doctors? I mean, the doctors are trying to help people that really need it. If they're talking about addiction and drug dealers, why do they not do something to help people with addictions instead of punishing people that really need this help? Because whenever I came to Dr. Salerian, I was on the verge of committing suicide. He gave me my life. I know that people are saying, well, that's what they all say because they want their drugs. I've been on all of these topic sites reading things that people, and it is ignorance. There's no other word to define what they have no idea. When I go into a pharmacy to try to get my medication filled, I'm treated as, the best word I can use is low class is how they treat me. But it's worse. It makes you feel, I worked 2 jobs. I raised my children on my own. I'm a very active person. Went from outgoing, sports, being with my children. Now I have grandchildren, so I couldn't get out of the bed due to the pain that I endure every minute of every day.
Tammy,
if I have to take medicine to help me, why does that make me a drug addict? Why does that make me less than a person? It doesn't. Yeah. But they are punishing so many people to try to fix a problem that they really don't want to be fixed, but they want us to go to the methadone clinic. I don't need to go to the methadone clinic. I'm not going to a doctor for an addiction. I'm going to a doctor for pain. And then I've had several pharmacists say to me, well, I just don't understand why a psychiatrist is prescribing these kind of drugs. Well, you know why? He's the only one that sat down and told me every part of my brain, how it works, my body. It really told me what was wrong with me. And this has been going on for several years. The only doctor. He understood the depression, the anxiety, the stress. And I could tell him, I want to die. I don't want to get out of bed another day. No other doctor, when you say that to another doctor, they want to send you to a mental facility. I need my problem fixed. And for some of us, surgery is not going to fix the problem. There's no surgery that's going to help me. I just wanted to help with my pain, to get me to where I could get out of the bed, enjoy my life again. When I can't, my head is telling my body to do something and it can no longer do it, that's enough right there to send someone into a deep depression.
Tammy, these are great words. I think you're very articulate. I certainly know the pain that you've been experiencing. Let me comment on some of the things that you brought up. One is what you're identifying is that as a society, we have a prejudice against people with pain, whether it's physical or mental, that now in our minds we have created a subclass. It's truly, I do not know how not to be angry and to be polite and politically correct in saying we really treat people with pain, whether it's mental or physical, as modern slaves. This is the truth. It bothers me. It gets to me. It's irrational. Addiction is not a crime. What's wrong if you have an addiction? Addiction is an illness. If you're addicted to a substance, it's an illness. We don't have to take your dignity away because you have a problem. That's how I see it, and it's a fixable problem. If you have pain, it's a problem. If you have a brain disease, it's a problem. You see, our bigger problem is we've been now conditioned to think that people with pain, physical, mental, or addiction, are less than us, that there is a subclass. And now, once we accept this category and introduce it even into our language, without being bothered, then everything else is justified, and society then finds different ways of any problem that surfaces. We have an easy answer. Car accidents. Oh, it's drug addicts. Sudden death. Da-da-da. It's, Vanessa and I were talking about this, reminded me, two famous people who died that I know. One is Bice, Lenny Bice in this area. If you say Lenny Bice, everybody remembers one thing. He was a coke addict and died. No, Lenny Bice died of a heart disease. I correct. Go and check the facts. Sylvester Stallone's son, Sage, at the age of 36, died. I bet everybody thinks he died. What the paper said, narcotics. No, let's correct it. He died of a heart disease. This is an example. When there is a sudden death, automatic assumption, it's drugs. It's now lawyers and us scientists know. Association is not causation. Association is not causation. But we say it in practice. The moment we see an association, even if it's your dentist gave you a pain pill that week and you die, we know you died because you abused this. Tammy, that's the bigger problem we have. I think that you're part of this movement. Really, I admire your courage in speaking up, and I'm asking everybody, the answer is to educate our fellow men. I think there are some other people waiting, so thank you for the comments, Tammy, and thank you for your support.
Thank you, Dr. Salerian.
Next, yeah, please.
The next question comes from the line of Joe Joseph with Orion Talk Radio. Please proceed.
Yes, Dr. Salerian, this is Joe Joseph, OrionTalkRadio.com. Question for you. Has the D.C. mayor suspended any liquor licenses due to the rampant alcoholism in Washington, D.C.? And that addiction, is that ongoing, or is this just a witch hunt that focuses on certain stigmas in regard to Schedule II medications?
I'm going to let my attorney, Bernie, answer that.
Thank you. I don't think it's an either-or situation. I know that the mayor possesses the emergency power to shut down a restaurant or a liquor store if there's violence that occurs in or about the place and they believe that alcohol is connected. But no, as a regular fact, liquor stores are wide open and they're very popular, and restaurants and bars thrive in this area. No one sees any connection, though, between that and Dr. Salerian probably know the thousands of people a year who die as a result of drunk driving.
Very, very interesting. And my follow-up question to that would be simply, do you guys know if there was a complaint lodged against your practice, Dr. Salerian, that prompted the mayor to take this action?
I can only speculate, but I know that my patients didn't. What I faced, I think it's a matter of the record now, 4 patients were identified. What I know is all 4 patients respected me for what I have done, and they were not even aware of the complaints themselves, nor they had consented for the city to take action, nor they had consented for their records to be released. These are major questions vis-a-vis our Constitution, human rights, and confidentiality. But I'm not proud to say that I yielded under pressure. I was being forced. I did not have a choice, and my lawyers convinced me that if I did not do it, there will be more serious consequences, and I did. I'm not proud of what I did, but I did. I did let the records. The complaints did not come. Clearly, the complaints did not come from patients, and patients were not asked. Bernie, do you want to comment on this?
Administratively, and there's only so much I can talk about because these matters are pending, the mayor's letter and directive and summary suspension of Dr. Salerian, based on everything we know now, was not prompted by a patient complaint. In the last hearing we had, there were 4 patients, so there wasn't a single complaint of any patient there. So to answer your question, I'm unaware of any patient who's yet complained. These are other doctors, pharmacists, other people tangentially related to the patient that have made these complaints.
Very good. Thank you.
Our next question is a follow-up from the line of Tammy Leach. Please proceed.
Yes, there's been many pharmacists tell me if you're live in another state, that it is illegal to fill a prescription from another state if you live in another. Say, if you lived in California, if you went across the line to Arizona, that you couldn't get that prescription filled. Is that a nationwide law that you cannot get a prescription filled from another state? I understand that you have to follow the state's guidelines, but is there a guideline saying that I can't get my prescription filled from California and fill it in Arizona?
You know, I can answer with confidence that, no, we're one country. We have one constitution, one president. Any doctor who's licensed in any state can prescribe prescriptions that will be honored all across the United States. And there is no such law. I'm very aware of what you're saying. Unfortunately, I'm convinced that it's a common practice, but not reflecting our laws or guidelines.
Okay, well, what about the pharmacist, instead of calling the doctor's office to verify your prescription, the first phone call they make is to the police department? And the next thing you see is officers walking in when you're trying to get your prescription filled and treating you like a criminal.
It's very unfortunate that happens, and I know as a doctor I'm aware of it. These are confidential records. We all assume that our medical records are confidential, but not according to the observations I have. And there are apparently now some very specific federally funded programs that in fact promote this. one of them is HIDTA, high-intensity drug trafficking area, that encourages free communication between pharmacy and other agencies, and we're not taking special precautions to protect the sanctity of the confidential information. We're not maintaining, we don't have the systems. I don't think the system is developed to compromise privacy, but we're not doing, my observation, my guess is we're not doing a good job in preventing the confidentiality and the privacy of an individual citizen who's receiving treatment. It's a great concern, Tammy. These are things that we have to struggle and we have to ask our presidential candidates to address for us.
And I realize we have to, it is a struggle, it is a fight, but I just cannot get my head wrapped around the fact that they have did this to not only you, to thousands of doctors and patients, and has resulted in suicide, that they don't have a plan set up to deter those people, to help those people. They do not care. That's how I feel. I feel like they do not care about the people that aren't drug addicts, the ones that are not trying to sell their medications. I do not understand why we have to suffer because of people that do those kinds of things, but I also have sympathy for, I know more times than none that there's something behind the addiction that drives someone to an addiction. My addiction is I'm addicted to not having pain or being able to level my pain. That's what I'm addicted to. I'm not trying to get high on anything. And I'm so tired of being treated like a lower-class citizen when I walk into a pharmacy and they're looking at me. I feel, it's just a feeling that you really can't explain in words. You can't put it in words unless you have experienced it. And then you have the ignorance behind it. And then they give you these laws and reasoning, well, it's illegal for me to feel this because of this, this, and this. Then when you have someone like me that knows a little more and a little better, that question them, then they get angry, and I'm sick of it. I just don't know what else to do.
I think you're doing it, and you're doing a great job articulating it, and we're hopefully going to publicize the battle that's going on. And it's true, it's not your imagination, it's not a feeling, it's a fact, it's an observation. It is true. Anybody who carries a controlled substance medication, the moment you give it to the pharmacy, the attitude is there. It's not your imagination. Don't feel you're paranoid. There is an attitude. It's nonverbal, it's there, and that you are treated as a second-class citizen. Please understand that. That's discriminatory and based upon ignorance. That's it. And then let us see how we can address this.
Well, I want to fight as long as I can fight.
What we're doing is really fighting. We're going to fight it through laws and by speaking up and having confidence that by speaking up, we will be heard and we will be making the change. And I'm by your side.
Thank you so much, Dr. Salerian.
Thank you for all your support and your courage and voice.
Thank you.
Okay, thank you for all the questions. I'm going to end our press conference at this stage. Thank you for coming. Wonderful.